Okay, guys, we're going to continue with the musculoskeletal assessment, which is our upper and lower. So I'm capturing everything for you today. That wouldn't normally be the case where you're doing all of the joints, okay? One thing to keep in mind though, guys, if you have two joints bilateral, you need to be inspecting, palpating both, okay? So we need something to compare. If we had a affected versus an unaffected side, I want to assess my unaffected side first and then compare to the affected side. All right. So we're going to start from the neck and work all the way down. For the purpose of the video and lab, we are not going to be doing the wrists, fingers, ankles, or toes. Okay. You do need to know how to do that for theory, however. I'm sure it's on an exam somewhere. Okay. So I do have Mr. Lopez here. I've already come in and talked to Mr. Lopez, introduced myself. I've done my hand hygiene. I want to make sure that Mr. Lopez is not in pain. And then I would ask, if you do have any pain at any time when we're going through these exercises, please let me know and I'll stop.
Okay.
Okay. I also want to take note of any grimacing. Our patients tend to want to appease us and to go through and do what we ask, but just be mindful of facial expression as well. All right. So we're going to start with your neck, and I'm going to be looking and touching you and going through some range of motion activities. Is that okay?
Yes.
And if you have any pain at any time, you just want to let me know and I'll stop.
Okay.
All right. And then I'm also going to test muscle strength. So for each of these, you need to state your findings on inspection, your findings on palpation, your findings on range of motion, and your findings on muscle strength. So there's a lot involved with this assessment. Okay, so I'm just going to get you to stand up, and
Okay.
if I can get you to stand here, and my shoelace is undone. And we're going to start with the neck, right? So we're going to look, and I'm inspecting the neck. I'm looking to see, is it midline? Is there any deformities? I'm taking note of color. It's not reddened. There's no signs of inflammation here. And I'm going to then palpate the neck. And are you okay? Any pain in the neck?
Not at all.
You want to ensure, guys, that you're getting right in there. It's not just a little touch. I want to support her. And I'm getting right in here, and let me know if there's any pain or tenderness here.
Nope.
Perfect. I'm taking note of the temperature as well while I'm in there. I'm not noticing any deformities as well. The temperature is warm to touch. Okay. So I've done that. We're going to go through and do some range of motion activities here. It is very important that we keep our hand cupped on the joint. Can you just turn a little bit towards me? So I've cupped that joint, and we're going to go through and do the ROM exercises. You need to know the medical term and the layman term for your patient. So you want to make sure for your patient, you explain simply what they need to do, and then you need to document in the medical term. So can I get you to bring your chin to your chest?
Sure.
For flexion. And back up in neutral position. She's in extension now. Can you bring your neck backwards? Hyperextension. Perfect. Can you bring your right ear to your right shoulder without lifting your shoulder? Perfect. And your left ear to your left shoulder. Perfect. Can you turn towards your right, turn your neck towards the right, and then again towards the left for rotation? Perfect. So I am not noticing any crepitus. The hand on the joint, you will actually feel that crepitus in addition to an audible noise that you may hear as well when you're going through that. Okay, so there is no pain or tenderness noted. There is no crepitus. She has full range of motion, and the muscle tone is normal. The only time you get to say normal. I'm going to check her muscle strength. So I will do it just on flexion today, but normally you need to do it on every movement. And I'll just show you with the neck what I mean by that. So I'm going to place my hand on your forehead, and I'm going to put some pressure, and I want you to resist.
Okay.
Okay, so push. Perfect. And off to the side, and push my hand away, and push my hand away again, and at the back, and push. Perfect. We are going to grade her muscle strength as a 5, okay? And there's a beautiful chart in Jarvis that describes that. Perfect. We're going to move on to the next set of joints, which will be her shoulders. So I'm going to get you to turn. No, actually, let's do this.
Okay.
I'm going to be inspecting. We want to inspect the shoulders. I'm looking to see, are they equal bilaterally? So the contour and symmetry of the joint is really important, and the muscle. So this is what I'm looking for here. I'm going to stand anteriorly, and then I'm going to move back and have a look back here too, just to see the height. One's not hypertrophied. One's not higher or bigger than the other one, right? Her scapula or formed in the correct hemispheres as well. There's no issues there. All right. I'm going to just palpate and touch and squeeze your shoulders a little bit. Is that okay?
Yeah, that's okay.
Support your patient, guys. Get in there. Let's do this side. It's easier. You want, it's not just a little touch. You actually have to get right in there and give a good squeeze. Any pain or tenderness in the joint?
I'll pay you to do that all day.
Okay. All right. Take note of your findings on that. Then we're going to go through and do some ROM exercises here. So there was no pain or tenderness. It was warm to touch. No deformities were noted here. Hand on joint again. We're going to go through some ROMs here with her and layman terms. All right. So can I get you to bring your arm up to the sky? I'll do it with you. Perfect. And that is flexion and back down to neutral extension. Can you bring it back behind you for hyperextension? Perfect. Can you bring it back down to your side? Can you cross it over your body for adduction, ADD? And away, abduction. Awesome. And they do have circumduction, little airplane. Perfect. Okay. Oh, I hear some cracking in there. All right. We want to do internal and external rotation. So internal, think of your hands being in handcuffs. Can you bring your hand behind to the small of your back? Perfect. And again, back here to behind the nape of your neck. Awesome. There we go. So that is shoulder. So now we need to state the findings for the range of motion. So there was some crepitus noted on circumduction. Okay. She had full range of motion. Muscle tone was normal. And no pain or tenderness was noted. Correct?
Correct.
Perfect. Okay. I would do both shoulders. You need to make sure you're doing both. All right. So again, for the sake of the video, we're just doing the one side. All right. Our next joints. Let's talk about elbows. Can I get you to turn? And we need to be inspecting the elbow. So I'm going to be looking. You can touch. I'm not palpating, but I'm looking. And I want to ensure that they are equal bilaterally here. Okay. There's no deformities. I'm not seeing anything there. I'm going to palpate. Any pain or tenderness in the elbow?
No.
And you're going kind of down the arm here as well, guys. If you have tennis elbow, you're going to feel that pain in there. Okay. All right. Can you face this direction for me? Perfect. So again, you're going to be cupping the joint and back just a tad. I'm going to go like so. Okay. So I have my hand on her joint, palm up. We want the elbows kept tucked in. Okay. Tuck them in nice and tight. You can put the other one out too if you want to do it. Okay. Palm up is supination. Can you turn your palm down? Pronation and back up. Perfect. Okay. I'm not feeling anything there. I'm going to put, sorry, can you make your Popeye, you ate your spinach. Can you make me some? Yeah, good. And back down to neutral. So flexion and extension. Perfect. Okay. Smooth movement noted. No crepitus. Any pain or tenderness?
Not at all.
Awesome. We need to test for some muscle strength here. So again, I'm going to put a little resistance on your arm. And can you bring your arm up to the roof? Perfect. And bring it back down. Perfect. She's a 5. No issues there. And again, both sides you would be doing, guys. All right. Let's go to her spine. Okay. So with her spine, and of course, your patient would be in a gown for this. All right. So I'm inspecting her spine. I'm looking for the curvature of her spine, taking note of any deformities, scoliosis, lordosis, anything along that line. And I'm noticing that her spinal column is erect and it is midline. All right. There's no concerns there. I'm going to go through and just palpate. Let me know. Any pain or tenderness as I work down?
Not at all.
Perfect. Okay. All right. And I'm not feeling anything as either. And again, skin is warm to touch. She has no pain or tenderness noted. And we're going to go through and do some ROM exercises here. All right. So I'm just going to keep, let's go this way. I'm going to keep my hand on her spine. And we're going to go through and do some motions, okay?
Okay.
Can I get you, she's in extension currently. I'm going to get you to bend forward to flexion. Okay, and back up to extension. Perfect. And can you lean back for hyperextension? Awesome. And back. Can I get you to slide your right arm down your right leg for me? Awesome. And the other side. Perfect. And can I get you to stand straight? And I want you to do the dance, the twist. Can you do the twist to one side and the other? Perfect. Oh, she's good. Okay, perfect. There we go. That's your ROMs for the spine. We need to do the muscle strength and test that as well. So let's do this on flexion. Can you stand back for me a little bit?
Sure can.
Okay. So if she was doing it on flexion, I would put my arm here, my hand here, sorry, and get her to lean forward. Okay. And I'd grade that as a 5. Okay. And then again, we'd put your hand here for hyperextension. Okay. And you would so on. Okay. I won't go through them all. All right. So that's the spine. Next would be the hips. Before we do the hips, I'm going to assess her gait. So very important to assess the gait. So I'm going to ask my patient to walk. Can I just get you to walk to that table over there for me?
Sure can.
And then walk back. One thing to remember is never ask your patient to walk normal because they're like, oh, what's normal? And then they change their gait. So you want to assess the gait. I'm noticing that there was equal arm string, it was smooth movement and coordinated. All right. So we're going to do some hip range of motion, but I want you to get here a little closer to the bed for me.
Okay.
And just to turn towards the bed. So first we need to inspect. And again, with the hips, you're looking at both and are they the same height, right? Looking at the shape and the contour of that joint when you're in here. Now, again, your patient would be in a gown, right? As you're going through and inspecting both, okay? Turn towards me. Right towards me. And again, from anterior and posterior checking, okay? Again, same height. All right. I'm going to get in here and palpate. So what I need to do, you can hold the foot of the bed for me, okay? Is you need to find your greater trochanter. And this is often a little bit of an issue because often we think that it's up here. This is way too high. So to find that greater trochanter, guys, this dip here at the hip, if you bring your leg out, so right there at that dip or panty line, perhaps, if you want to say, that is that head of the greater trochanter. That is where your hand needs to be placed for this. All righty. Okay, you got the bed. You want to make sure that you're supporting your patient and giving her something securely to hang on to, not a wheelchair. So the foot of the bed would work fine. Okay, so what I'm going to do is we're going to put my hand on your hip here. And then I'm going to get you to go through some exercises and I'll do them with you as
Okay.
well. Before we do that, I need to back this up. One moment. Palpation. I need to get in here and palpate really well, guys. Any pain?
No, it actually tickles.
Okay. You're going to do both. State your findings. Okay, there we go. Now we'll do this exercise. All right. I think I want to go like this. Okay. So what I would like you to do, she's in extension currently. I want you to bring your leg forward for flexion and straight back for hyperextension. Good. And back down to neutral. Perfect. I want you to bring it out to the side for adduction. And ADD, adduction across your body. Perfect. Good. Flat on the floor. I need to assess for internal and external rotation. So what I would like you to do with your left foot is keep your foot on the floor and just turn it in like mine. Perfect. Internal rotation and then out. External rotation. Very good. Awesome. Okay, so that's all of the ROMs for the hip. Again, you would be assessing bilaterally. State your findings. Pain, smooth movement, was there any crepitus, and so on, and muscle tone. All right, so we need to do muscle strength on this one. Can I get you to grab the foot of the bed
Sure
as
can.
well? And again, if I was to do it on flexion, I'm going to put my hand here, can you bring your legs straight out in front just like we did? And I'm going to put some resistance here.
Sure.
Okay, perfect. And then I would go at the back. Perfect. I'm showing you all these. And out to the side. And then my hand's going to go right tucked in and in towards. Perfect. There we go. Muscle strength is a 5. Alrighty. Next, we are going to do knees. So knees are a bit trickier. Have a seat, please.
Thank you.
Okay. And the tricky part of knees is when we do the extension and flexion. And I'll get to that in just a moment. Are you able to bring your pant legs up at all?
I sure can.
So we want to start with our inspection of her knees. Again, looking for the contour, the shape of the knee. So you need to ensure you're having a really good look, and they do look equal bilaterally for the shape and the contour of the knee. I'm just noticing a little scarring, but that's more of an integumentary assessment, okay? I'm going to now get in and palpate that knee. So start up a little higher and go through any pain or tenderness in your knee.
A little bit.
Oh, where? Up in here?
Right there.
Right there?
Yep.
And what's that cost from?
That's probably for my knee surgery.
Okay, I can see you had is that a scar or something from childhood?
That is a scar right here from an ACL repair.
Okay. And again, you would be doing both, guys, as you're getting in here. She is worn to the touch. I'm not noticing any deformity. Nope, they're both the same. Okay, I'm not noticing any deformities there. So what you want to do is you want to put your hand right on that joint. And again, currently she is in a flexed state. So I want to go from flexed state to extension. So can you bring your legs straight out for me? Perfect. And then back down to flex. All right, good. One more time. And back down. Awesome. And there's no grinding. There's no crepitus noted there. All right, so again, you would state your findings for that. And lastly, we need to do some muscle strength here. So what I'm going to do is put my hand here on your leg. And if I can get you, I'm going to provide some resistance for you. And if you can just bring your leg out forward. Perfect. And then back down. Awesome. Good. So her muscle strength would be graded as a 5. I think that's it. We won't be doing ankles or toes. Again, fingers or wrists. So we have completed our assessment for our MSK.